Hey, I'm Dr. Talal Khan from Personal Primary Care and Weight Management, and I'm here to talk today about what longevity medicine actually really means. Longevity medicine has become one of the most overused and misunderstood words or terms in modern healthcare. There are podcasts going out about that. There are influencers who are trying to sell supplements. There are wearable companies that are trying to sell labs that you can draw yourself. Nothing wrong with having information, but it is what are you going to do with that information. Similarly, you have MRI companies doing whole body MRIs, and then you're left with figuring out the puzzle yourself. So patients have started to or have been empowered to do things and take things in their hand, but I think that these things are not that useful without having a longevity coach or having a longitudinal relationship with a primary care physician. Here at Khan Longevity Care, the system that we have built incorporates metabolic testing for metabolic optimization. We have whole body MRIs and genetic testing and advanced diagnostics for cancer screening. We do use peptides and we use GLP-1 medicines for longevity, and we do recommend supplements, but all of these are individualized to a specific person's needs. I remember when Steve Jobs had pancreatic cancer at the age of 56, he had access to some of the best care in the world, but he did not really have a champion as his quarterback. He did not have a longitudinal relationship or had invested in a relationship with a primary care physician. And I think that is important because longevity medicine is not just fancy blood work or whole body MRIs or 21st century cheat peptides to live forever. It is really about having a relationship and going back to traditional medicine where you have a family doctor, you have a relationship, but you're using modern technology to live long and have health span. Now, coming to health span is basically the ability to be healthy for a longer period of time. Over the past few decades, what we have seen is that people are living longer, but not always with the quality of life. Chronic disease is an epidemic in US. We are waking up to the fact that our quality of life really goes down in the last 10 years that we are alive. And the heart of longevity is that we can live as long as possible with a good quality of life without disease. And that would also bend the cost curve. I'm very passionate about bending the cost curve and decreasing the amount of money that we are spending in the healthcare system. And that can be done when each individual or every American has access to a model where they can invest in personal wellness and achieve vitality and not live with chronic disease, which is really driving the cost of healthcare out of proportion. So longevity medicine is about health span. It's not about immortality. One of the real barriers to longevity, in my opinion, is not just access to technology, because as I said, technology is widely available and right now, but it is really access to time and continuity. The time that you can spend with a provider. Most of us live in a system where we are used to rushed appointments and reactive interventions. I'm talking about proactive care, which goes upstream and prevents chronic disease. The bottom line, longevity medicine is not a hype, but it is often marketed irresponsibly. Done right, longevity medicine is simply medicine that respects time as the most powerful variable in health. If you're interested in maximizing your health span and living with a good quality of life, book a consultation with myself at Khan Longevity Care, a part of Personal Primary Care and Weight Management.